2, 3 o'clock, 4 o'clock, rock. 5, 6, 7.
Hello, my name is Bill Haley, and this is for Haley 2024 The Movement's Government Reform Ideas. Now, this video is going to be on Sector 20, which is the insurance sector. So how is insurance going to be dealt with within the new constitutional structure that I have listed here? So I'm proposing a new constitution for the United States. It replaces the current constitution, state constitutions, and actually creates local constitution. One constitution with the words federal, state, and local. We still have all three levels of government. We're still going to have judicial, executive, and the legislative branches, but we're going to structure the Constitution and government significantly different. We're going to go with a lot more liberty, a lot more free enterprise. We're going to go with competitive governance type of model of governance. So let's go over the whole Constitution real quick. I want to try to do it in like 5 minutes because I have longer videos out there. But you need to know what the whole structure is so you know how insurance is going to fit into this. So let's go on to this real quick. First thing you have to understand is with this structure, we're going to separate all government power into 30 sectors. Top level, elected leaders per sector. No one person is going to be in charge of, let's say, the commander-in-chief and environment, insurance and food, the courts and police, family law, and dealing with transportation. All these things have different top-level elected leaders. So we'll go over all 30 in a second. Then within each sector, you're going to have roughly 12 different competitive governing agencies. They're called competitive regulatory agencies. They govern, they regulate, and they send representatives up to the sector board level, where just a little bit of things that need to be monopolized will go up there for that very few things, dealing with negative externalities. The rating system is going to give high quality information from a wide variety of perspectives, and that's going to be highly important. And it's going to have a rating floor for significant negative externalities, so not so much has to go up to the monopolized level on the regulations. So let's keep on going, but you have to understand that these are full governmental systems too, with the executive, legislative, and judicial sectors. So each one will legislate, let's say on just education or insurance or on banking, land and water, and things like that. So let's keep on going. The Constitution will have about 12 or so, 13 sections in it. One citizenship, general laws, bylaws, or internal governance from each individual grouping here that we have in here. Sector 20, let's go with this real quick. Insurance, the transition from Social Security and Medicaid in the form of a proposed constitutional amendment creating the competitive regulatory agency, CRA structure. So we're going to, the insurance sector is going to take over Medicaid and Social Security and handle that transition. But let's keep on going. Federal, state, and local, I told you we have the three levels of government still, and that's going to help define some of that. Original authority, which is top level authority, and it's also the teaching on original rights and how we have laws in the first place. Supermajority, 70% vote if it goes to the monopolized sector board level. So that's going to keep a lot of things down to the CRA level. The parent sector board, how that's structured and what their responsibilities are. The sector boards over top of each one of their sectors, but they're not necessarily in charge. The CRAs are in charge, but they're in charge only when it's absolutely necessary, where things are creating significant negative externalities. So CRAs, competitive regulatory agencies, they are the base of this whole reform. This is 90% of everything we're doing here. So they're going to, everything else is to support the CRAs. The rating system, like I said, is high quality information from a wide variety of perspectives. Taxation, we still need to fund things. How are we going to do it? Most likely it's just going to be, well, within most of it, it is CRA fees. There are some taxes for the military and the like, but we already did videos on that. There's all videos on that. Debt, how do we switch over? And this in Medicaid and Social Security, that's a big transition. That's a big liability right now. And how we're going to do it, we'll go over it in this slide, in this video. Pockets of freedom, dealing with immigration and foreign policy. It's a unique idea. Let's keep on going, but there's videos on that. Everything's on my web page. Got YouTube pages, Facebook pages, and we'll probably add some more later, other social media. The separation of responsibilities and authorities into 30 sectors. Let's go over the 30 sectors real quick. I'm going to do it really rapidly. So 5 in the charity system, and that's highly important because we're not going to have a government safety net anymore. This is a government safety net. It's not going to be government, but this is a societal safety net. Everybody has to give some money to charities. The target is 5% of GDP. So those videos are out there on that, how we fund the charities and what that requirement is. But you see some of those sectors there. 5 in the foreign protection system. So we separate the powers. The top guy for the commander-in-chief is a different top guy for the top diplomat. 2 different people by design here. And each one of these have a top leader, and they all have different responsibilities. So let's keep on going. And there's videos on all those. Violent crime mitigation system, the definition of violent crime, the prosecutors on Sector 11, law enforcement itself, the law enforcement authorization. Everybody needs a societal oversight. The military had one also. I didn't mention that, but it's there on Sector 10. But the domestically law enforcement authorization, that's a societal oversight, making sure anybody with police powers, they have to, or governmental powers and police powers, both are the same, but anybody with those powers have to be authorized, and by 70% of the American people, or by their state or their locality. Prisons and corrections, that's highly important. That's separated. All these going, even the court system, all these things are going significantly into the free enterprise system, but with a lot better accountability than we currently have now. They still have to do due process. They have to do a fair procedures. They have to do the things that's right. They have to respect civil liberties, and we'll go over that. That's going to touch on a little bit of the insurance here, and the charities touch on it as well. Obviously, you got healthcare is a big part of what we're doing. We're switching from Medicare and Medicaid. Medicaid is gone. Medicare is going to be gone. We're doing a responsible transition from both of those. This one's going to be more talking about the Medicare. Medicaid is going to be within the charity system. Financial, we got 2 different sectors. One dealing with financial regulations. One dealing with banks with financial and the currency and the stuff. Insurance is what we're dealing with on this video. You got 5 more here. I'm not going to go over all of them, but they are important. And human resources and sales, that's HR. That's going to be part of your retirement. So that's going to definitely touch on it. Your identity is definitely going to be a big part of this. I will be doing a video on identity, but look at that on the website. So it's highly important. Environmental, not so relevant to the insurance one, but it can touch on it. Work safety and disability, transportation, media and communication, land and water. Okay, so those are the 30 sectors. Again, top level elected leaders per sector, but within each sector, at each level of government, you pick you select your CRA to govern you within that realm, and you have to be governed. The CRA has to do something to meet certain thresholds of being governed in that industry, in that sector. Okay, so what a CRA is, again, is that they're full governments. They can have they will have a judicial department, legislative department, executive department. They regulate, they govern, and they send representatives. And the representatives go to the sector board level, and if the governing is, or if the regulations are done at the sector board monopolized level, it still gets regulated at the CRA level. Not regulated, it gets governed at the CRA level. It's executed at the CRA level. They might have to do what the monopolized sector board says if it creates a negative externality, if you're not high enough on your ratings or whatever the case may be. This is done at the city, state, and federal. So it's highly important that you understand the whole structure of what we're dealing with. Because in insurance, you're going to have to know what you're dealing with. Now, insurance companies are going to select their CRA, but each individual, when they select their CRA, when they select their insurance company, they're most likely going to select this insurance company regulated by their CRA, insurance CRA, because why wouldn't you? You want to regulate the insurance company that is giving you services. But if you go with the regulatory agency that gives too much power to the insurance company, you're not going to want to go with them. If you give too much power to the individual, for the policyholder, the insurance company can't make any money, or it drives up the cost too much, you're not going to want that either. It's going to create a nice balance between too much to the insurance company or too much to the policyholder. Let's continue going. Sector 20. So it is a sector. It is going to have a certain level of responsibility. The parent sector board defines its responsibilities, and everything has to be within one of the sectors, so it defines it. It's going to run into some of the overlap or gray area with financial regulations, no doubt. But the insurance is going to try to concentrate on the insurance nature of the financial arrangement. And you'll get to see what I'm talking about. And those lines might be blurred. You're going to want to go with the financial regulatory agency and an insurance regulatory agency that are like-minded. You don't want to go with ones that clash. And that's going to be important. The insurance sector is established. Establishing a sector means that you get your full set of CRAs. And a full set of CRAs means you have to have membership of at least 5% of the citizens and no more than 20% of the citizens. So that's what establishment means. That means you also get the rating agencies as well, with a full rating system and that rating floor. That rating floor is highly important, and we'll go over a few clauses on that. But if you have not looked at the CRA video, if you have not looked at the rating system video and read through what I have, you really have to do that to have a better understanding of what the rating system is, what a civil liberty is, the civil liberties part of the judicial department, and the whole lot. It's all encompassing. But this video cannot be 30 hours long. I'm breaking it up into pieces. But the videos are out there, so you'll see it. The purpose of the insurance sector is to regulate insurance. So that's a minor definition. The parent sector board will put more meat on that. But that meat it cannot be regulatory in nature. It has to be, you have to cover auto insurance, business insurance. I'll go over the different types of insurance in a minute. Life insurance, retirement insurance, and stuff like that. The insurance sector board must create a responsible transition from this. Okay, this is a clause. The insurance sector board must create a responsible transition from the Social Security and Medicare by fulfilling promises consistent with the following relevant clauses. So we're going to have relevant clauses in a minute. But the sector board is the monopolized sector board. It has to create a responsible transition. So it's highly important. And I have a full transition portion of the Constitution where it lays down some timelines of when we transition over. Okay, so we have to go with the relevant clauses. That's going to be within the next couple clauses I have going here. Through the 5-year transition period, both the current taxes and benefits will cease. Now, we add new taxes, don't get me wrong, and we'll have benefits, don't get me wrong, but the current benefits and taxes will have to cease. But let's look at what I have going on. Okay, any citizen over the age of 70, and I'm talking about who's already eligible to be in the Social Security benefits, will receive a lump sum into an annuity that will match their Social Security distribution and healthcare premiums. So if you're over 70, you're going to get a lump sum into an account, an annuity type of account, that will give you a certain amount of money per year to match your Social Security and what's needed for a healthcare premium that's similar or roughly similar to the Medicare. So that might be hard to define, but that's the goal right there. Okay, citizens lose 0.4%, that's 240 units of 100%, 240 units. They lose 0.4% of that lump sum amount for every month under the age of 70. So at age 60, you're going to have half of your amount. Age 50, it's gone. You get nothing. You look 240 units times that 0.417 makes 100%. So anybody over the age of 50 gets some. 51 gets very little, 52 gets a little bit more, 55 gets about 25% of it, 60 gets half of it, 65 gets 75% of it, and 70 and older gets the full amount. So it's highly important to understand that we really start backing off on benefits. If we give everybody who's 18 and above right now, who's ever paid Social Security, their full Social Security amount, lump sum, ready to go when they're 65, the amount we need to collect in taxes is going to be overwhelming. And those people who have to work, who's 25, 30, 35 now, their tax rates are going to be so high to pay for what they're getting. What I'm trying to do is not tax people just to put money into their own account. I'm trying to have a good balance of having people start paying for their own retirement accounts. So the more we give to the people, the more we have to tax, and to take tax from the people to put into their accounts. It defeats the purpose. Let people save their own retirement, and we'll go over how we ensure that. Okay. The age is determined when the amendment takes effect. So there will be a time frame where we'll mark the date of what your age is. So if you're 55 and 4 months, you're going to get whatever it is. I think that's 26, 27%, somewhere around there, of the total amount that you would need for Social Security. So we have a system. Funds needed for these annuities are government liabilities. So the government has to come up with this. We have a full section called debt in our Constitution. I think it was section 9 or 11 or something like that. I forget now. I have a debt one. There's taxes and then there's debt. Debt deals with selling off all government assets, dealing with all the liabilities the government has, state, federal, and local. All the liabilities, and then it has all the assets too. And we're going to create an asset. This is the debt. This is definitely a liability for the government. So you have to look at the video I did on debt to really understand what we're talking about. Okay, for the purposes of partially defraying Social Security and Medicare debt liabilities, so we just created a huge debt, a huge liability. Now let's go on the other side and try to raise a little bit of money to pay for that. For 50 years after this amendment passes, Sector 25, which is an identity sector, their CRAs must place a 5% income share loan. You have to know what that is, that you pay 5%. Their share loan receives 5% of your income. That's what it is. On their members. So everybody has to do it. And I always put minimums on my taxes. You cannot go out of work and not pay. Everybody has to chip in to pay the debt that government has for us. Everybody has to be part of that. Even if you're not making any money, you go work in the charity economy or you take it out of your savings, you do something, but 3% is not a lot. It can be somewhere between the 1,000, 2,000, somewhere around that range. With a minimum of 3% of the state average per capita income. States have a different per capita income. So, but I put it for this, and I think I did the math around $1,200 to $1,500. I think I have it in a minute on one of the slides. Until the member reaches the age of 50. So once somebody reaches the age of 50, they stop paying this tax. That means they're putting all that money into their own retirement account. So if somebody's who's 50 years old, they get zero money and they pay no taxes. They're right there on the edge. If you're 45 years old, or let's say 49 years old, you only pay taxes for that 1 to 5 years, whatever you are, if you're in the upper 40s. If you're in the upper 50, right about 51, 52, you pay no taxes, but you only get a little bit of money. So I try to do that balance. We never want somebody to have to pay taxes to fund their own account. But we have to have an asset. We have to have money coming in to partially defray the Social Security debt liabilities. Okay, so age 50 is a big mark for me. And you only pay taxes until you're 50, this 5% share loan. The revenue derived from the share loans must be applied to the debt subject to Section 12. Oh, let me go back. If you've been building up an asset a long time and you hit 51, or you go over the age of 50 and you don't have that debt liability, and then you cash out on all that, yeah, you're probably going to have to pay 5% for what was reasonably before you were 50 years old. So there'll be some CRAs, there'll be some rating floors dealing with somebody who just builds up a lot of assets and then has their payday right after that, because that's tax avoidance. I know tax avoidance is the legal type and tax evasion is the illegal type. We just want to make sure we're trying to do as fair as we possibly can and not let somebody slip under the radar and not pay a partially what we need as a society to pay off the debt that we created. I know people have a lot of problems saying we, it's the government that did it, but we're part of America, and to live in this great nation, we have to pay off the debt that our leaders put us in. They did a bad job, in my opinion, but that's a subject for another time. Anyway, the revenue derived from these share loans must be applied to the debt subject to Section 12. So it has to be applied to the debt. So these are just major assets that's going to be in the monetary system. I just did my videos on the monetary system. These share loans, these are assets. These are things of real value in the monetary system that can be traded back and forth. They'll probably be grouped together with in the likes of 100 or 1,000 or something, but these are real assets. So let's keep on going. From the rating system section, so this is going to a different section. This is not in the insurance section, but the whole Constitution should be read as one. But let's just go with this. An individual living an impoverished life is a societal negative externality. It is a negative externality. It harms everybody for somebody to be sitting on the street corner, homeless, and causing problems and just looking bad for society that somebody's out there homeless. And it puts a big burden on our charity system just to take care of anybody who is homeless, who doesn't want to work. So a impoverished life, societal negative externality, is something that we can say that you have to do something to keep your standard of living up to a certain minimum, so you're not creating a situation where the charity system has to take care of you. You have to have a certain amount of insurance. You have to do certain things to not become a burden on society. Now, you have to have a 70% vote for this, so it's not going to be a lot. I really try to look at my percentages when I do this, so I'm not creating a situation where it's burdensome to people out there. But it's also it's burdensome to the common man who takes care of their responsibilities to see all their charity money going into helping somebody who doesn't want to help themselves. There's a balance there, obviously. There's people who are going to be working in the charity system, the caseworkers that know what to do. They're going to be the wisest among us to try to get people out of that situation. But if somebody just says, I'm not going to do anything, take care of me, that's not going to work either. We have a system for everything in here. Look at those videos. I can't get into it all right now, but that's highly important to understand that when you are, if government's not going to take your money for your own retirement, you have to do it yourself. You can't just, there will be a rating floor on standards for car insurance, life insurance, house insurance, health insurance, all these things. So a rating floor means you're creating too much of a negative externality, a significant negative externality, if you do not have insurance or some way to take care of your needs when certain things happen. So you have to be part of the risk pools out there, because your house burns down, you don't have house insurance, and all of a sudden you become a big burden on our charity system. I know that's what the charity system is there for, but it's there to take care of people who have done reasonable amount of things, reasonable measures to not to become a burden on society. Otherwise, the charity system is going to be too big. It's going to take care of too many people. Too many people are going to hop into the wagon versus pulling the wagon, and the system's not going to work unless we can kind of force everybody. You have to take reasonable steps to take care of yourself and not become a burden on society. It's a big, long explanation, and I know people have a problem with that. That's controversial without a doubt, but it's also controversial to force somebody to pay for somebody else's not doing anything. And I have a charity system with that's going to look for 5% of GDP, roughly $1 trillion. That's enough to take care of people who fell on hard times but did reasonable things to help themselves out. But it's not enough to help everybody else out. Let's say nobody saves up for their retirement or somebody doesn't. And now you have to take care of them when they're 75 years of age. They can't do productive work anymore because of their age, and they're more fragile health-wise. And people don't like that. People don't want to give to them because, hey, you didn't do something reasonable. And we don't want people living on the street. We don't want 75-year-olds thrown out and you don't get any health care, you don't get this and that, you don't get food. That's a negative externality. And as a society, people don't want to see that. And there's a balance between people not wanting to see something like that versus the us forcing them to take reasonable measures to help themselves. Anyway, long story, and I go over that a lot more in the charity system and the like. But this is an important sector to go over that. So I try to justify it, but that's 70% there. 70% vote to set or increase that rating floor. That's heavy. I mean, that's a big part of society saying, yeah, you have to do this. You can't just go around being homeless and without eating and all that stuff. Okay, let's go. Let's talk about how that works a little bit here. This is the actual clause. The insurance rating system may set or increase a societal negative externality rating floor with a 70% vote. So it's going to be hard to increase it. That's a heavy percentage. A 35% vote lowers the rating floor. We need a way to lower it as well. And 35% of the people can lower it. Hey, you're just having it too high. Okay. In many areas of concern, insurance CRAs must ensure its members reduce their chance of becoming a burden on society in retirement, healthcare, dependent care, among other categories that achieve a 70% rating system vote. So I listed some of the major ones: retirement, healthcare, dependent care, but it is anything that can achieve that 70% vote. And then how high they set that rating floor, it's a different thing. And there's a lot of ways to do it. It's a 50-year-old guy or son of a 75-year-old father or mother. They can sign saying, I'll take care of them. And then that means that older couple, they don't have to save up for their own retirement because they have a son or daughter or child that's going to be responsible for them. So there's a lot of ways to get above that rating floor. So there's a lot of mitigating situations from heavy-handed government control. Everybody's in their own CRA. The CRA they selected to deal with this type of thing. The rating system, that's a monopolized system, and they're all representatives of the people. A lot better representatives of the people than we currently have right now. Okay, if 60% of the Sector 2, Sector Board, that's the charity finance, the charitable distribution associations, they handle the money for charities. If 60% of the Sector 2 Sector Board representatives declare a specific area of need is too high and could be better addressed or could be addressed by better insurance, the insurance rating system must raise its rating floor in that specific area. So if they say that elderly care, that's creating too much of a need for the charity system, you have to save up more for your retirement or make more provisions for your retirement. If they say too many people are being homeless, you might have to have better house insurance. I know that's not exactly relevant to every degree. I'm sorry. Unemployment compensation or unemployment, that's all private stuff now. You have to have better unemployment compensation, or you have to work through the charity system. You have to do something. You cannot become a burden on society by not taking reasonable measures, is what I'm getting at. And this is not 50% of the people saying that. This is 60 or 70% of the people saying that, depending on sector 2, sector the insurance sector, which is at, what is that, 19? I think it is 20. Okay, let's see. Okay, this is not a clause. These are some of the type of insurance: life insurance, health insurance, car insurance, business insurance, home insurance, retirement, dental, unemployment, hundreds of other types. I just listed a few, but it's going to deal with the insurance nature of it, not necessarily the financial nature of it, which is included. I know there's going to be blurry lines between that, and you're going to want to get your financial CRA and your insurance CRA that kind of work together well. Funds needed for Social Security and Medicare are government liabilities. That's tens of trillions of dollars. It's not a clause there. I already did this. This is repeating it. I just wanted to repeat. Tens of trillions of dollars worth of liability there. No doubt about it. It's a lot of money. And $10 trillion, that's equivalent to about $100,000 per household. That's let's say what is it? Let's say $11 trillion. $11 trillion is $100,000 per household times about 110 million households. So it's a lot of money. So we have to understand there's a lot of money out there. So it's a big liability, no doubt about it. But limited to only people over 50. It's prorated about 0.4% per month. So that's how much it drops down per month, depending on your birthday. Means if you're under 50, you get nothing. Half that amount if one is 60 years old. So if you're 60 years old, you get half the amount that you would have. Now, it's an annuity. You can't touch it probably till you're 65 or 70 anyway. But it's an annuity that will pay out a certain amount. It's going to match Social Security, but I wanted to show you that. And annuities can be fashioned in many different ways. For example, one way could be, let's say you have $200,000 into an annuity, and they say as soon as you pass away, all that money goes back to the insurance company or the annuity, and that means you're going to be able to get bigger payouts. But the other method is all what's left goes to your estate and gets passed down to your children or whoever you will that money to. That annuity is not going to be paying out per month as much as one that goes back to the insurance company. And I think you understand why, financially, why that is. Because you're going to have that more money going back to the insurance company to pay out more people with bigger payouts per month. If everyone under the age of 50 receives funds, the amount of taxes needed would overwhelm the system and drive up taxes for those people who are under 50 or even who are 60 years old, 70 years. If you're still working and you're still paying taxes, this is going to overwhelm the system. We need to limit our liability dramatically. And if it's a one-time deal and we're not going to have the Laffer effect, then the people who are getting high levels of Social Security funds right now, it might be limited to some degree on theirs to a little bit lower amount to limit how much. Now, we don't want to do that on a normal basis because the Laffer effect means people are going to sell off assets and stuff to create a situation where they have higher benefits. It's another lesson on economics. But anyway, let's keep on going. This is not a clause. I'm just repeating some of the things that we went over already. You pay taxes until you are 50. It's a 5% income share loan. So 5% income tax. Right to your CRA. That CRA has to turn it over to the debt system. The parent sector board is going to be ultimately involved in that, but your sector board is going to initially collect it and then turn it over to the parent sector board. It's all worked out in my debt section. Okay, let's look over some of the actual numbers for a minute. And I didn't do all the tables. I didn't do everything, and that's not part of my job here. I don't have that education skill level to know that. But the minimum of 3% of a state average per capita income. So I say 5% income share loan, but there is a minimum. Even if you don't make any money, you're a housewife or you're retired, or not retired because you have to be over 50. some people retire before 50, but anyway, even if you don't have any income, you're a housewife, you're a student, you're a 21-year-old student, you're 18 years old, you're paying this amount. Now, some of the per capita income, I think, is Mississippi or something, 44,000. Your income share loan would be $1,300 minimum, and places like D.C. or some of the more rich states, their average per capita is 85,000. Therefore, that 3% would be about 2,500. So it depends on what state you're in, but there has to be a minimum. And if you're just a housewife, say I don't earn any money, how can I pay any taxes? You work in the charity economy. Everybody has to pay. Otherwise, taxes have to go up on the people who are paying, and then that discourages the economic transaction. And the people, even the housewife who goes out shopping using somebody else's money or whatever, it's going to be built into every tax, every transaction, because taxes get built into every transaction that's out there, because transactions are what gets taxed to a large degree. Real estate tax is a little bit different, but even that is within transactions of the house in the whole 9 yards. Work in the charity economy, everyone must chip in. So if you don't have the money, you work in the charity economy, and $2,500 is not a lot of hours to put in to work in the charity economy. People can make that happen. We have a similar thing for many different things, such as the charity system. If you don't earn any money, you still pay money towards the charity system. And if you don't have the money because you're not working, you work in the charity economy, and it's going to be around those same dollar amounts. It's easy to earn $3,000 in the charity economy, 4, 5, 6, 7 hours a week. But everybody has to chip in. Everybody is being protected from foreign foes. Everybody gets the rule of law. They get protection from the police. They have the prison guards guarding the dangerous criminals that would hurt people. There's a lot of things that are being done. Now, if you are totally disabled, you are totally without the ability to make any type of money or be able to put money or work into the charity system, you can apply to the charity system, the AO sector, Sector 3, I believe it is. You can apply to them to get rid of your tax liabilities, and there is a method for that, but it needs like a 70% vote to make that happen. And that will happen to a lot of people who have, let's say, Down syndrome or significant work-related, productivity-related problems. People who are blind, they might have limitations, but they can still make a good living. Their brains still work just fine. Just because they're blind doesn't mean they can't do the work. And the charity system is going to be specialized in putting them to work in a productive manner. Okay, partially defraying Social Security and Medicare debt liabilities. An asset in the Section 12 debt. So the money coming in is going to help defray that. And it's just going to go into the big pool of debt, liabilities or the asset side. Impoverished life societal rating floor, just going back over that is what's going to create a situation where everybody has to save up for their retirement. Nobody can just say, I'm spending all my money, I'm not doing anything for retirement, and when I hit 65, 70 years old, my productivity goes down because my health and everything, and oh, by the way, society just take care of me. No, that's not going to work. That's the reason we have Social Security in the first place. We did a horrible job solving that solution with Social Security. Very poor system, but we have a better system of just forcing people to do some measure to take care of themselves for long-term. Let's say you put money into a long-term annuity that starts when you're 70, 72 years old, and it goes until you pass away, and it's not that much money. You can even build up those assets in the charity economy, so that can even work. Minimum requirement for saving for one's elderly years. So Sector 2, the Charitable Distribution Association Sector Board may raise the rating floor with a 60% vote. Again, that goes back to that part of the insurance where if Sector 2 is saying, hey, you're putting this section is having too much burden on our charity system, deal with that with the rating floor for the insurance, then that's what they do. Okay, pretty much done with this video. I wanted to show you all 30 sectors again so you understand what we're dealing with here. You can look at the charity system, the foreign protection system, violent crime mitigation system. All these places are going to have places that you can work in the charity economy. Really new, innovative ideas. When you get rid of government control, you go to CRAs, you can have really innovative ideas. Government control, government regulations are the death knell to so many ideas. Then you just have to look at these and see how each one of these sectors might be included. Insurance is going to be included in a lot of different areas here. So you just have to try to think about each area, how insurance is going to affect it. And I always like to stop on this slide right here. You select your CRA. You select your RA. These RAs have a vote in the impoverished life rating floors. The CRAs create the regulations to regulate you, and they're competing. Everybody's going to know another regulatory agency is doing better and go to them unless your CRA does better. So that competition is going to weed out the bad and enforce the good. Okay, long video, about 41 minutes to do this one sector, but it's so important to understand what we're dealing with. So, Haley2024.org. I'm really revamping that website right now. It's middle of July 2021, and I'm really trying to incorporate a lot of the YouTube videos. I'll be doing that soon, and going back and re-editing and looking over all my reforms to make sure they're consistent with the new Constitution that I worked at for the last 9 months or so. And anyway, please consider a donation to the website. Starting this month, July, I started paying somebody to help me with some social media. So hopefully you'll see some more social media starting in maybe 3 or 4 weeks, because they need to build up to a system of really good edited articles and pages and reforms, and to get it out there nice and neat. But I'm ready for this to explode out there into the world, and hopefully by August, September, we really start making some progress. Before, I've been holding back on social media to a large degree so I can really focus in on the reforms and making sure I have things consistent. Anyway, please consider a donation to help pay for the different things that need to be paid for. And until the next video.